Hi viewers, welcome to Your Media Square. Today we are having a special guest, Dr.Meghna Verma, and she did her medicine MD from Mumbai, MD Ophthalmology, and she did her executive MBA program from ISB, and then recently she did a postgrad diploma program in psychiatry from CMC Vellore, and she has loads of experience of 14 years in ophthalmology and medicine in various hospitals in Hyderabad, like LV Prasad, PACE hospitals, Refractive. She's one of the directors in the PACE hospitals. Welcoming Dr. Meghna. Hi Meghna.
Thank you. Thanks for inviting me here, Surendra. And I would love to share my experience as a doctor and as administrator of hospitals with you. I'm also an NABH assessor and would like to share the best practices of healthcare management with all of you. So thank you for having me here.
So guys, today we'll ask a lot of questions about our ophthalmology general issues, psychiatry, healthcare management. We get a lot of answers from Meghna, as she has done varied programs and very hard worker. I know her personally, been working for a long time here in Hyderabad. So she is here now today. So Meghna, tell me, what are the major issues in the kids? Especially, I can see a lot of kids, they are having this myopia, they are wearing glasses. Is it a lifestyle issue or else a foods issue? Why they are getting it?
Surendra, till recently, even ophthalmology, the science did not believe that it is induced by environment, but more and more research nowadays is showing that myopia is environmentally induced. For example, if you see in China and Singapore, almost 90 to 95% kids in Singapore have glasses. Comparatively in India, it's much lesser. But it is thought because in Singapore you have very little open spaces, and the kids are inside their houses all the time. And because of this, because since their childhood they are not used to seeing long distances, they are always within the four walls of the house, and they are not used to seeing long distances. They're always reading their books and they are always not really exercising a lot. Myopia can be induced. Also, a recent research shows that if you make your child play outside in the sunlight for 45 minutes every day, it can significantly reverse the myopia, or it can at least decrease the progression of myopia. So I think science is going back to the old age saying of what our parents or our grandparents used to say, that too much of reading and too less of playing gives you glasses. So science is proving that recently.
So what are the basic symptoms in kids we can think about whether they have the myopia, and how often they have to go to the eye checkup clinics?
So the best age to detect myopia in a kid would be around 3 years, because that is the time that they can identify the letters, or they can read the chart which is given by a general ophthalmologist to them. Though the earlier the better. I would not even say 3 years. A general checkup within 1 year of birth is also advisable. So the earlier the better is the dictum. But definitely once the child starts going to school, when the child enters PP1, that would be a good time to go to an ophthalmologist and get the child's eye check done. Most of the children who come to me usually come at the age of 5 years or 6 years, when they have gone to their first grade, and either the teacher has said that the child is not able to see when they are sitting in the back benches, or nowadays most of the schools have these school screening programs. So when the school screening happens, when a doctor comes to the school and does a screening, they detect that the child has some problem, and then they refer to an ophthalmologist. So most of the kids who come to me are actually discovered by accident. Sometimes it happens that the child comes to us by the time that they are almost 9 years or 10 years, and by that time it is actually a little too late, because by that time the child's the neurological loop between the brain and the eye has already developed. So the best age, I would say, is around 3 to 4 years, that every parent should get their child's eye checked once between that age. If at that age the child's eyesight is detected and the child needs glasses, the child till the age of 7 years, it can be the child does not have the risk of developing lazy eye. After the age of 7 years, or maybe after the age of 10 years is the cutoff, I would say, when if the child has already developed lazy eye due to myopia, then the correction becomes very, very difficult. So the best age for a screening would be around 3 years, when the child enters PP1 or PP2.
Okay. So nowadays we can see a lot of YouTube videos people are following, and they think that exercises and reflexology works for them. Do you think so? These eye exercise helps in reducing the myopia or else eyesight?
So there are exercises which help in accommodation, or some people, their eyes cannot focus on one object in distance and in near accurately. That is called as accommodation. So exercises do help in accommodation, but in reducing myopia is something that allopathic science or ophthalmologic science does not really believe in. Though there are a lot of like parallel branches of medicine like Ayurveda, Unani and all that, they really believe that exercises can decrease myopia, but allopathy really does not. But I would say that no harm in trying. It will definitely not cause any harm. If at all it causes any benefit, there has been no scientific research around it, but you never know.
Any specific diet would you recommend? This will help for the kids?
Yes. So again, I would say the age-old philosophy that a lot of green leafy vegetables and vitamin A is something which is required for our eyes, and vitamin A is available in anything which is yellow or orange in color. So you have your papaya, or you have carrots, mango. So any fruit which is yellow or orange in color is a good food when concerned with eyes, and all the green leafy vegetables. They should be a part of our normal diet to prevent night blindness and other diseases which can happen, eye diseases which can happen due to vitamin A deficiency.
Once it's been identified with the myopia, they will be suggested with the specs. Yes. What do you say, they should wear the specs all the day during the classes, at home, watching TV? Every time they should wear it, or else on and off they can keep it and keep it aside?
Actually no, because as I said, myopia, the right age for detection is 4 years. The latest age by which myopia usually leads to lazy eye. So what happens, if a child is used to seeing a distorted image from birth, at the age of 10 years, even if you give glasses to the child, the image correction will happen at the eye level, but it does not happen at the brain level. So the child is now, the neurological loop is now adjusted to seeing that distorted image and to seeing that low level image, myopic image. So even if you give a glasses to a 10 or 12-year-old child, sometimes they don't correct back. It is no use to give them glasses, and this condition is called as amblyopia or lazy eye. The only way to prevent lazy eye is that once glasses are given to a child, the child should wear the glasses all the time. If they don't wear the glasses, they wear it only for some time and keep it off again, as you were asking me, then the chance that the child develops lazy eye are very, very high. So once the child is prescribed glasses, they have to wear it throughout the day. The only time that they remove it is during sleep time.
Okay. So in the elders, we can hear the word of computer vision syndrome, who are working on computers. Above the 15 years, 20 years, we can see a lot of people are wearing specs. Can you say something about this computer vision syndrome?
So actually, I do get a lot of patients from IT industry. Their chief complaint is this blurring of vision sometimes during the end of the day, or dryness of eyes, irritation in the eyes, and things like that. So this is basically what happens is, especially in the IT industry, they are always indoors in an AC environment. Plus, they are looking at the screen all the time. So when you're looking at a laptop screen, your blink rate decreases. We tend to stare when we are looking at the screen. Any screen, TV screen or laptop screen, we blink less. So blinking is very important for distribution of your tear film on the eye. And because of a less blink rate, the tear film distribution does not happen properly. Plus, the evaporation of the tear film increases, which leads to dry eyes. So a dry eye is very, very common in people who are always on the laptop, especially in the IT industry. And to prevent that, obviously, they should have some kind of routine where they take their eyes off the screen every 1 hour, 1.5 hours. That they also adjust their eyes to looking at a distance, not keep on looking only at short distance computer screen. So when they take their eyes off the computer screen, they should look outside a window every 1 hour, 1.5 hours. Take some short breaks to let their eyes have a little more exercise than just seeing on the screen all the time. Also, not using AC, especially if you're in the AC environment throughout in the day in the office, at least you should not use AC in your home or something like that. Some kind of adjustments can be made. But yes, computer vision syndrome is very, very common in the IT industry. And if detected, if any IT professional has these kind of problems, they should not ignore it, but see their ophthalmologist and take care of it as soon as possible.
Do you think there is any relation between the eye vision, stress, anxiety, depression? There is a lot of words are going on with the software people and workaholic people, management people. What is meant by stress, anxiety, depression, and any connection to the vision?
So I would not really say a direct connection to the vision, but yes, again in the clinic setup, we do get a lot of patients who are having headache. The main reason for their headache is the stress, anxiety or depression that they are going through, and then they think that maybe the headache is because of the specs. Because it is not, our Indian culture is not very open culture where you accept that depression is a problem or anxiety. Like you cannot tell your boss, I am depressed, right? Your boss is not going to be kind to you. So the way it manifests it's called somatization, where your anxiety or depression comes up with somatic symptoms. One of the somatic symptoms, as I said before also, it could be headache, it could be that you feel there is some kind of irritation in your eyes or you're not able to see properly and things like that. So not a direct connection with the eyesight, but somatization could be one of the symptoms of why a lot of people suffering with anxiety and depression actually visit an ophthalmologist. And as an ophthalmologist, I think we should also not just write them off by saying ki, oh, you don't have any specs and you don't have any problem, but also try and address their bigger issues, their real issues, because they might not see any other doctor except you. So try, as ophthalmologists or as doctor communities, we should always look for the issues beyond the presenting complaints.
Further questions you can write down in the comment section. And as I said, she works in Pace Hospitals in Refractor. You can consult her. You can post your questions in the comments. Yeah. Thanks for watching, guys, and we'll get back with you with few more videos.
Thank you for having me here. So thank you. And for any more questions, I would be really happy to answer them if you can put them in the comment section. Thank you.